Hi, I'm Mike Shoemaker. I'm one of the professors here in the physical therapy program, and I want to thank you for joining us and helping our students with this standardized patient learning experience. These are third-year students, so they are close to graduating, and so we're really trying to push them a little bit, and so we want you to be tough on them. This is a good, safe environment where they can make mistakes and they can learn important lessons. And so one of the things that I'm going to ask you to do is to really only provide the information that they ask for. So if they ask something about pain, don't provide them the whole paragraph about pain on your sheet. Respond to the questions as they were asked. If that means that they missed something, so be it. And this is really the environment in which they can make those mistakes. And then in the debriefing later, we can cover those mistakes. And they're going to be a lot better off for it than if you were to offer them all of the information out of sympathy or pity. They don't need your sympathy or pity. They're adult learners, and they're really looking forward to challenging themselves and to having the opportunity to learn from their mistakes. So again, answer the questions the way that they're answered. And I think it's also important to make sure that you're staying in character. So don't differentiate between yourself and the character. They should be one. So you shouldn't say, oh yeah, that hurts, but that's just me. That's not the patient. Don't try to separate that out. So this is a case where you did a lot of painting in your house 2 to 3 weeks ago. That was a lot of ceiling painting. So you were looking up and you were painting. So a lot of overhead movement in this case with your shoulder, and it was that repetitive overhead movement that inflames some tendons in your shoulder. They of course aren't going to know that, but that's for you to know, and it's their job to figure that out. Part of the challenge here though is they're going to have to sort out between, is this left shoulder pain coming from the shoulder or coming from the neck? So there's two variations of this case. Half the students are going to get a case where it's coming from their neck. The case that you're portraying is the one where it's coming from your shoulder and from the tendons in your shoulder. So this is a dull ache. It's just on the outside of your upper part of your shoulder here. You don't really have a good idea of what's making it worse, although you do know that working for prolonged periods of time at your computer make it worse. You're left-handed, so a lot of mouse work seems to make it worse. And you feel like, when you're doing stuff with your shoulder, it feels a little bit worse, a little more achy when you're moving that left shoulder. And sleeping at night has been a struggle, but they have to ask, well, why is it a struggle? It's a struggle because you like to sleep on your left side, and sleeping on your left side makes that shoulder pain worse. And so, for you, you can't sleep well, not so much because of the pain is keeping you up and preventing you from going to sleep, but just because you can't comfortably get in the position you like to sleep in, and so you're tossing and turning more than you normally would. You've been taking Tylenol, which helps a little bit, but obviously it isn't taking care of the pain to the point where your friend had suggested that you come in and see the physical therapist. If they ask you about numbness or tingling, you don't have any numbness or tingling. If they specifically ask you about whether you feel like your shoulder feels weak, you can say, yep, it feels like there's a little bit of weakness there. With regard to your medical history and your review of systems and your medications, you will get a 2-page document that is essentially what you would have filled out in the waiting room, and we'll fill that out for you. And that's going to be information about your medical history and some symptoms and your medications. So we'll have that all filled out for you. You'll have a history of high blood pressure and high cholesterol. You're on medications for both of those. A couple years ago you had a left heart catheterization because of chest pain. And since then you won't have had any chest pain, and the left heart catheterization was normal. Again, all that's going to be on that sheet is the left heart cath. They're going to have to ask you, oh, what was that for? That was for chest pain I had 2 years ago. Oh, well, have you had any pain since? What were the results of those tests? Again, make them ask the questions. Don't just offer all the information in one fell swoop. Again, you're on Tylenol for the pain. You're on Zestril for blood pressure, and you recently started on Crestor for your high cholesterol. If they ask you, it's important to note that you started the Crestor about 6 weeks ago. And the reason we want to put that in there is because that medication can have a side effect that causes back, shoulder, and neck pain. And so we want them to at least be thinking about that side effect and to ask about that and have to deal with that. It's a distractor, it's not relevant in this case, but again, if they ask you about that Crestor, you know, and how long you've been taking your medications, you can tell them that you started that one recently. Your social history can be whatever it is. It can be yourself, it can be whatever avatar you want to be. You know, but I think that just makes it easier for you to talk about who you are, what your interests are, and those sorts of things. For the examination, again, they're going to look at both your neck and your shoulder to try to figure out where the pain is coming from. As you do different movements of your neck, they're going to be look up, they're going to be look down, bend, you know, rotate, things like that. There are two movements that are bothersome to you. One is when you look to the right, and when you bend to the right, you're going to report that there's a pulling across the top of your shoulder. It's not the same pain, but you do have a pulling in those muscles because those muscles are tight and they're guarded because of the shoulder pain that you've been having. As they check your range of motion in that left shoulder, reaching overhead and reaching behind your back and sort of reaching up to the side causes kind of a sharper pain inside your shoulder. You hadn't really noticed that before, but there's a sharper pain in your shoulder with those movements. And then as you do strength testing, any time they're testing a shoulder muscle, so it might be pushing down this way, might be pushing down from the side, they might have you try to rotate out or rotate in. Any of those movements are going to, again, cause that sharp pain inside of your shoulder. If they do sensory testing, it is what it is. If they test your reflexes, they are what they are. As they palpate muscles and bones, you can report that there's, as they palpate just off the tip, the bony tip of your shoulder, just down from that, you can report that that area is tender as they're palpating. You can also, and you can say, oh yeah, that is the pain that you're having. And then you can also have muscle soreness as they palpate up along this upper trapezius muscle, as well as the muscles over the top of your shoulder blade. And those can be sore. Those aren't the pain, but those can be muscles that are really quite tender. Again, they have to ask, is that the pain that you came in for, or is it just tenderness? If they don't ask, they don't ask, and then that's an item that can come up in the debriefing that they can learn from. There'll be a couple special tests that they are going to do that reproduce that achy pain along with a sharp inner pain. One of them is called the empty can test, where they have you put your thumb down and then they're going to push down on your arm and have you try to fight against them. And you can really kind of, you know, oh, that really hurts when they do that. Another one that they might do is going to be turning, they're going to put your arm in this position and then they're going to push down and in, and you can almost come off your seat, like, oh, that really hurts that spot and is a sharp pain inside of the shoulder. Really everything else that they do, you know, should be whatever it is. So thank you again for joining us for this experience. I'll certainly be around to help brief you before the event starts on the day, and thank you.